Jennifer, your CNA today. I'd like to perform foot care on you. Is that okay?
Sure.
All right, I'm going to wash my hands and get my supplies. Washing my hands. I'm going to put a paper towel on the sink because I'm going to have to get some water into a basin. For my supplies. I need soap and lotion. I need to get two washcloths, a towel, and a barrier for the floor. I need gloves. I need a wash basin. Go ahead and put my gloves on. Okay, would you prefer me to do your left foot or your right foot? Your left foot, okay. Always offer preferences. Excuse me, let me borrow your foot. Take your shoe off. Always make sure you're supporting the extremity. I'm going to put your foot on top of your shoe. Never put the foot on the bare floor. Okay, I'm going to support your foot. Are you comfortable? I'm going to roll your pant leg up so we don't get it wet. Make sure that you're adjusting the temperature of the water with your hand under the water. Don't multitask and hold the basin in your hand and turn the water on to get it warm. And make sure it's not too warm, even though it feels very warm and comfortable for you. You don't want it hot because they're going to have to put their foot in it. So whenever you're using water on a patient for any skill, you have to make sure that the patient tests the temperature of the water so that it's comfortable. Hold your basin with 2 hands. And do not rest your basin in the sink anywhere. That's an infection control issue. It doesn't have to be super full, but it has to be full enough where it can submerge at least the part of their foot in it. Put your basin down, turn your water off. Miss Alex, can you hold that paper towel? I'd like for you to test the water, make sure it's a comfortable temperature for you, and you can use the paper towel to dry your hand. Is that a good temperature for you? Take your towel. Okay, I'm going to support your leg. We're going to lift your leg up. Put your foot in the water, just toes are a little bit first. Is that comfortable for you? Use one washcloth for washing, the other one for rinsing. So first I'm going to get her foot wet. This skill requires you to always support the extremity, and you have to wash between the toes. Okay, I'm going to lift your foot up. I'm going to wash your foot. Washing your ankle, the bottom of your foot. You see the whole time I'm supporting, washing the surface of the toes, and all I'm going to do is put the washcloth between the toes, making sure that you're cleaning between the toes. It's very simple. Okay, I'm going to rest your foot in the water. Use my other washcloth to rinse the foot. Make sure I'm addressing between the toes. You can do it in the water, but you literally need to move the toes. Don't ever, never leave a washcloth in the basin. Okay, now lift your foot. We're going to dry your foot now. You pat it dry, addressing the bottom of the foot, the surface of the toes, and I have to dry between the toes. So you can put the foot on your barrier and literally dry between the toes. Okay, now I'm going to put lotion on your foot. Make sure you don't gob too much on there. You have to warm it between your hands. I'm going to put lotion on your foot now. I'm going to dab off the excess lotion. Okay, now I'm going to put your sock back on. Is that comfortable? Mm-hmm. You have to put the shoe back on and lift your foot up. When you're tying the shoelaces, make sure you ask about comfort. Don't tie them so tight that their circulation is off in their toes. Just tie them. Just don't go ee. It's not good if it's too tight. Is that comfortable for you? Okay, I'm going to lift your foot. And put this in my laundry basket that I'm going to pretend is right there. Pick up my basin. You can multitask if you like for this. It's foot care. Anything below the waist gets put into the toilet. Make sure when you're pouring your water out, your basin is not so close to the toilet that it looks like it's resting on it. Rinse it out. You have to make sure that whatever equipment you're using that requires water, that all your equipment is completely dry. If you put it away wet, it's a bad thing. Take everything out of there. I'm going to put my supplies back where I got them from. Make sure my table is dry. Close my toilet lid. Make sure every time you use gloves you take them off properly. Washing my hands right away after I take my gloves off. Here's your call button. Would you like your table in front of you or for me to leave it where it's at?
Right back.
Okay. Would you like a magazine or a newspaper?
A magazine.
Okay, I'm making a correction. I would have closed the curtain before I started washing her foot, and this is the point that I would open it. I would use a barrier whenever I'm moving the curtain. I asked preferences. She has her call light. Asked preferences on which foot she'd like for me to start with. I'm done.